So in the previous video we already know that the angiotensin 2 does not control the secretion of the deoxycorticosterone, which is done by the ACTH. Now a few words about the renin-angiotensin-aldosterone system. The renin is secreted by the JG cells or juxtaglomerular cells, which is surrounded by the renal afferent arterioles as they enter the glomeruli. Now aldosterone secretion is regulated by the renin-angiotensin-aldosterone system, or in simply RAAS, in a feedback manner. So let's see how this feedback manner works. In the juxtaglomerular apparatus there are some cells which secrete the renin, and it converts the circulating angiotensinogen to angiotensin 1. This is converted to the angiotensin 2 by the help of the angiotensin converting enzyme, and this angiotensin 2 acts on the adrenal cortex, as we know, to increase amount of the aldosterone. This aldosterone, we know, has the main action on the sodium and water retention and decreased excretion of them through the urine. Therefore they increase the extracellular fluid volume or extracellular fluid volume expansion, and the neat result is the increased renal arteriolar mean blood pressure and decreased discharge of the renal nerves. When they occur, they inhibit the renin secretion from the juxtaglomerular apparatus, and by this mechanism there is a feedback manner to control the sodium and water balance inside the extracellular fluid compartment by the action of this RAS or renin-angiotensin-aldosterone system. Now if there is a drop of the extracellular fluid volume, or if there is any hemorrhage or any diarrhea, GI fluid loss, or intra-arterial vascular volume, there is a drop. So what will occur? There will be increased renal nerve discharge, mainly sympathetic renal nerve discharge, and decreased renal arterial blood pressure. Both of these effects increase the renin secretion from the JG cells, and therefore it increases the production of the angiotensin 2. There is result of the increased sodium water retention, because angiotensin 2 promotes the action of the aldosterone by increasing its synthesis from the adrenal cortex, and there will be increased extracellular fluid volume, and the result is the shutting of the stimulus, which is the initiated by the increased renin secretion. So in nutshell, please remember how this renin-angiotensin system acts on the sodium and water balance with the help of the aldosterone. It is a very important topic on this matter. Now if there is hemorrhage, as I was talking about, there will be increased ACTH and increased renin secretion, and like hemorrhage, the standing posture and the constriction of the inferior vena cava at the thoracic level also decreases the intrarenal arterial pressure, which increase the angiotensin 2 production via the renin. There will be increased synthesis of the aldosterone. Also the dietary sodium restriction stimulates the aldosterone synthesis from the adrenal cortex. So by this manner, the different conditions which changes the sodium water balance in the extracellular fluid compartment increases the secretion of the angiotensin 2 and the aldosterone, and thereby always maintain a constant hemostasis of the extracellular fluid volume. Now the third point on the aldosterone synthesis regulation is electrolytes and other factors. Here we will mainly discuss the action of the potassium. Remember an interesting fact, that any act which decreases the plasma sodium concentration by 20 milliequivalent per liter stimulates the aldosterone secretion. But this type of huge change of the plasma sodium concentration is very rare and is life-threatening. But remember, the plasma potassium concentration need to be increased only 1 milliequivalent per liter to promote the aldosterone secretion, and the transient increase of this condition may occur after a meal. So postprandial increase of the potassium ion in the plasma also responsible for increased aldosterone secretion. What is the mechanism of action? mechanism of action of the potassium is when the increased plasma potassium occurs after a meal, this huge amount of the plasma potassium enters the cell by the sodium potassium ATPase and they depolarize the cell. Huge amount of the potassium entering the cell, so there will be the depolarization, and you know depolarization always opens some voltage gated channels. Here they open the voltage gated calcium channels. CAV means voltage gated calcium channels, and these voltage gated calcium channels when open, they allow entry of huge amount of the calcium ions inside the cell, so thereby increasing the intracellular calcium ion concentration. And you know calcium ion increased inside the cell always promote exocytosis or degranulation of some secretory granules. Here the increased secretion of the aldosterone occurs by the help of the increased intracellular calcium ions. Now, like angiotensin II, the potassium ions also increase the conversion of the cholesterol to the pregnenolone and deoxycorticosterone to aldosterone. So it is same like the angiotensin II. There are two modes of the action of the potassium. Now, the sensitivity of the zona glomerulosa to the angiotensin II and consequently to a low potassium diet is decreased by the low potassium diet. Now, the effect of the body posture. In normal persons, the plasma aldosterone concentration is increased during the portion of the day where the person is carrying the activities in the upright conditions. So, mainly daytime. What is the cause? Number one, decreased removal rate of the aldosterone from the circulation by the liver, number one. And number two is a increased aldosterone secretion due to postural increase in the renin secretion. So, whenever we maintain upright posture, there is increased renin secretion. Now, you can ask me the question, what if the patient is bedridden for a prolonged time due to some surgery or bone fracture or some accident? In those cases where the person is confined to bed, they also show a circadian rhythm of the aldosterone and renin secretion, with the maximum value of the aldosterone and the renin secretion occurs in early in the morning before the awakening or before normal time the patient or subject is used to get up from the bed. It's also seen in the case of the ACTH secretion also. So there is a diurnal variation of the secretion of the renin and the aldosterone and the ACTH. So in this context, we also discuss the function of the ANP, atrial natriuretic peptide. As we all know, atrial natriuretic peptide was responsible for the escape phenomena. Now the ANP has also a role to inhibit the renin secretion, and also it decreases the responsiveness of the zona glomerulosa to the angiotensin II. So what is the mechanism of action by which the ACTH, angiotensin II and the potassium stimulate the aldosterone secretion? Number one, ACTH, there the intracellular mediators is cyclic AMP, protein kinase A. In case of the angiotensin II, there is diacylglycerol and the protein kinase C. And in case of the potassium, we all know the second messenger is the calcium via the voltage gated calcium channels. If you can remember these things, it's very well. So thank you all for watching this video. If you have any queries or any comment, please let me know in the comment box. Thank you.